Hi everyone, good morning. We are going to explain today about the dominating news cycle because of this coronavirus, COVID-19. You're starting to throw around words like quarantine with an easy casualness, but what do these words really mean for your life? If you are going to hear, you saw in the news, lockdown,
Paano na kami? Paano hindi ka na matandaan para makapasok sa lugar na yan? Nagugutom na ako hanggang nila ako.
Sa unang araw ng quarantine sa buong Luzon, mga inabutan ng pagpapatupad.
Sinabihan kami maghintay. Naghintay kami. Bakit napasok na kami? Hindi na.
Kalbaryo ang sinapit. Kabilang sa mga naipit, doktor na napilitang maglakad at iba pang nagtatrabaho sa sektor ng kalusugan. Ngayong pahirapan ng pagpasok sa trabaho, ang dole, may tulong pinansyal daw sa mga manggagawa. Sa paliparan, naghahabol din ng mga gustong makalipad bago ang 72 oras na palugit.
So if we miss this flight, what we gonna do? It's too hard.
This is the result of imposing quarantine. So first, we are going to explain because many concerned people, they don't really know what is quarantine means. So quarantine doesn't have to be a scary thing. It is an effective way to protect the public. So we are going to understand that there are 3 ways to protect yourself without freaking out. You must understand what is quarantine, isolation, and social distancing in a pandemic situation. But today we are going to explain, trying to discuss what's the difference of quarantine and isolation. Especially in the Philippines, government use quarantines to stop the spread of contagious disease. So here, quarantines are for people or groups who don't have symptoms but were exposed to the sickness. A quarantine keeps them away from others so they don't unknowingly infect anyone. Quarantines may be used during outbreaks. Outbreak means when there is a sudden rise in number of cases of a disease. Epidemics, this is similar to outbreaks, but generally this is considered larger and more widespread. But pandemic is larger than epidemics. Generally, the effect is global in nature and it will affect and it will infect more people. So that's the difference of outbreaks, epidemics, pandemics. So our case today, it's global. The coronavirus, this is a pandemic. So, what is self-quarantine? People who have been exposed to the new coronavirus and who are at risk for coming down with COVID-19 might practice self-quarantine. Health experts recommend that self-quarantine lasts for 14 days. 2 weeks will provide enough time for them to know whether you have unknowingly been exposed to an infected person. So self-quarantine, it involves first using standard hygiene. Just like you are going to wash your hands frequently. Second, not sharing things like towels, utensils, and others. Now, those were the principle that involves quarantine. You are going to stay at home. Third, fourth is not having visitors. So this is the time you are going to omit first birthday parties, any celebrations, any gimmicks, or any occasions that will produce gathering of people. You are going to stay at least 6 feet away from other people in your household. So here, once your quarantine period has ended, if you do not have symptoms, you are going to follow your doctor's instructions on how to return to your normal routine. So if you're working in the company, if you're working, now this is the time you are going to communicate with them. Now, what's going on? Now, you are going to wait what will be the declarations coming from the executives, what to do. Now, whether you're going to work back and then go back to the normal routine. So that is quarantine. But when you will say isolation, this is for people who are confirmed to have COVID-19. So isolation is appropriate for them. Isolation is a healthcare term that means you are going to keep people who are infected with contagious illness or disease away from those who are not infected. Isolation can take place at home or at a hospital or care facility. Special personal protective equipments will be used to care for this patient in the healthcare settings. A question that says, others will say, what is enhanced community quarantine? And will it work? Now, you're going to know that what exactly does community quarantine means. If you are going to read the news, there is a memorandum signed by Executive Secretary Medial Dia, ordered and signed also by President Duterte on Friday, March 13. This is shared with media last Saturday, and it defines this as taking place on 2 levels. So this community quarantine, now in the Philippines, there are 2 levels. The first level is called a general community quarantine. What does it mean when you will say general community quarantine? This means that the movement of people is largely limited to accessing basic necessary or necessities and work. So while uniformed personnel and quarantine officers are present at border checkpoints. Though the second level of this enhanced community quarantine is called as enhanced community quarantine. This is more akin to a total lockdown with hard borders. So we hear the news, there's what we call as lockdown in Luzon, lockdown in somewhere, no other places, not just here, not just there in the Philippines, but in some other countries. So in this scenario, there should be strict home quarantine for all households will be implemented. So what happens when there will be a strict quarantine? Transportation will be suspended. Provisions for food and essential health services will be regulated. And there will be a heightened presence of uniformed personnel to enforce quarantine measures. So in the border where lockdown is being imposed, you can see uniformed personnel. They're the one enforcing the quarantine. Because as we know, especially to the countries who are living in a democratic world, now most of the people, now before they are going to obey and follow the instructions of the executives and coming from the government, they are going to complain. They will be subjected not to follow and disobey, not unless if they are going to suffer, if they are going to experience. So that's the time they are going to follow now the order coming from the government. So here, in enhanced general community quarantine, now there is a purpose. Now one of the purpose here is to flatten the curve. So what is this flattening the curve? So when you will say flattening the curve refers to using protective practices to slow the rate of COVID-19 infection. So hospitals have room, supplies, and doctors for all of the patients who need care will have enough, sufficient now supplies. As you can see, a large number of people becoming very sick over the course of few days. This could overwhelm a hospital or care facility. Too many people becoming severely ill with COVID-19 at roughly the same time could result in a shortage of hospital beds equipments or doctors and nurses. So on a graph showed, now there's what we call a sudden surge in patient over a short time could be represented as a tall, narrow curve. On the other hand, if that same large number of patients arrive in the hospital at a slower rate over the course of several weeks, the line of the graph would look like longer and flatter curve. So this is the time there will be reduction, the number of confirmed cases, infected person due to this COVID-19 now will be lessened until there will be a gradual elimination, until waiting for a medication or vaccine discovered and invented coming from various experts. Now nowadays we have plenty of researchers and experts, scientists now who are racing, now who will be able to formulate the appropriate and exact medications for this one. Now, what are the other protective measures? Quarantine isn't the only way to protect yourselves during an epidemic situations. So we have one, social distancing. Now, when you say social distancing, that this involves avoiding large gatherings. If you have to be around people, you are going to keep at least 6 feet or 2 meters between you when possible. So there's what we call as social distancing is pretty much like common sense. And we have, second, you are going to stay calm. While fear is normal, educate yourself. This is a great way to counterbalance your feeling of anxiety. Because normally, if you don't know the situation, if you don't know, say for example, what is quarantine, what is isolation, what is lockdown, what is the purpose for doing this, why the government is imposing this one, now it will produce anxiety. So just stay calm and then educate yourself about this, because this will serve as a counterbalance in the feeling of anxiety. The people now that we feel nowadays. And then the other one, the last one is you are going to cooperate and participate with the authorities. Now, following quarantines and other public health mandates will help slow and stop the spread of a contagious disease. So we should remember that being cooped up inside may seems unbearable. Now it's boring to stay at home, but just do sacrifice, because sacrifice precedes first, and then blessing comes after. So, but the time will pass, and your forced vacation. Now, if you are going to, instead of having vacation, you are going to staycation at home, in your apartment, now to where community you're living in. Now it will help and may save lives. So this is an emergency situation nowadays. So we are opted now. That's why lockdown were imposed for the purpose of having quarantine, self-quarantine. Then there will be an enhanced community quarantine. So the main objective for this one is to prevent the spread, now to prevent the spread of this COVID-19 virus, and then as much as possible after that, gradually it will be eliminated, and soon after we are going to live normally. So if you have comments, if you have suggestions, you're free. And this is all for now. So guys, just have your happy staycation. Instead of vacation, you just stay at home. So this is all for today, and I say bye bye. Thank you.